Welcome to this episode of the Birth and Stool Experience podcast, where we discuss all things pregnancy, all things labor, and all things childbirth. I have an interesting topic today: postpartum hemorrhage. I call it interesting because of the impact of this complication globally. According to the World Health Organization, 14 million women experience postpartum hemorrhage globally. And with that, we have about 70,000 of them losing their lives annually. That is a huge number. And because of that, it's important to be able to identify the risk factors, already get at least a hint of what the causes are, and be able to put in a few things in place to just help minimize the possibilities of this complication happening. What is postpartum hemorrhage? Or even PPH. PPH is heavy bleeding, excessive bleeding after childbirth. Now, it may be quantified as half a liter of blood loss after a normal delivery or 1 liter of blood loss after a cesarean section. Now, sometimes it may be hard to measure the blood loss. However, any amount of blood loss that affects the condition of the mother, causing her to feel faint or get dizzy or even lose her consciousness, warrants attention. Therefore, it's important that both the healthcare worker and the mother are alert and are able to identify potential situations and scenarios and, have them arrested in good time. PH commonly has been found to have 4 causes. One being the tone of the uterus, the uterine tone. When the uterus, after the baby has been born and the placenta has also been removed, usually it's supposed to contract naturally. That aspect of contraction, it feels very hard, like a hard ball. That in itself is what controls and minimizes the bleeding from the womb. If the uterine tone is not as acceptable, then the lady can be at risk of bleeding. What are some of the things that affect the uterine tone? For example, over-distended womb. Over-distension here is maybe following a multiple pregnancy. She has more than one baby in the womb, or she has a lot of amniotic fluid in the womb. Another reason, another cause is tissue. For example, after the baby has been born and the placenta has been removed, unfortunately, a few pieces of the placenta and membranes remain inside the womb. This can inhibit contraction of the uterus. A third cause is trauma. Trauma resulted from childbirth, maybe tears within the birth canal, or if the lady received an episiotomy that has not been repaired. What is an episiotomy? An episiotomy is where the healthcare worker, cuts, creates a little bit of room within normally just at the perineal area, in order to create more room for the baby to exit. So any tears, any episiotomies will need immediate repair in order to arrest bleeding. And the other reason is blood clotting issues. Now, if this lady is on anticoagulant medication, treatment for blood clotting disorders, that can predispose or can actually contribute to postpartum hemorrhage. How can you know if you're at risk of PPH? During pregnancy, like earlier on I mentioned, when you're carrying more than one baby, that predisposes you to PPH. If you have a very large baby, 4 kilos and above, or if you have excessive amniotic fluid, that does predispose one to PPH. And also if one has had a previous history of PPH with previous pregnancies and deliveries. If one labors for too long or has a very quick, very short labor, then this is a risk factor in itself. Cesarean section or instrumental deliveries like forceps delivery pose a risk as well. How about after birth? I mentioned earlier on, products of conception remaining in the womb, pieces of the placenta and membranes that remain in the womb unforeseen, these ones definitely will inhibit contraction of the uterus and lead to PPH. Birth canal injuries is another reason, another risk factor during, after birth. Infection within the birth canal or even in the womb after childbirth, and also 6 weeks into puerperium. So within these 6 weeks, if the perineal area, the birth canal, is not kept clean, the lady can develop an infection. Remember, even with no clear risk factors, PPH can happen suddenly. That's why it's important to already anticipate any complication when you're preparing for childbirth, and just make sure that you have access to skilled healthcare workers and a good hospital for delivery of your child. Now, what can you do? What can a mother do to help minimize this complication? Antenatally, attend all your antenatal clinics. Make sure you have all your blood works done, all your tests done. Have your ultrasound scans done and any other tests that need to be done to rule out any risk factors. Now, the beauty of pregnancy is that it gives you time to prepare. As you approach delivery, it will be worthwhile to be able to explore a good health facility where you feel comfortable to deliver your baby. That said, it will be of importance to be sure that they can handle an emergency at any given time. One, that they have a doctor who's readily available to attend to you, even if you have your own private doctor. Sometimes your private doctor may be unable to reach to you as soon as you would need them to. In the event of an emergency, you need the quickest and nearest help available. So be sure there's a resident doctor. Be sure that you have trained healthcare workers. Be sure that there's access to a theater, in the health facility. And if they don't have a theater, do they have means to transfer you to a place that has a theater, to a bigger hospital? Do they have a nursery for your baby? Do they have a pediatrician who can attend to your child when it is born? Be sure to share any relevant medical history with your healthcare provider, as well as history about previous pregnancies and deliveries. Even if it was a miscarriage, let them know, because this helps in the planning for your care. During labor, we've seen that events can change rapidly. So it is important to also be able to stay alert, remain alert throughout your care. It may be a bit of a challenge for you as the mother because you have to handle labor and childbirth. But if you have a support person with you, they can help you, to just be attentive of what is happening and what needs to be done. For example, when you have been moved now to postnatal ward, you feel exhausted, you feel tired, and all you want to do is sleep. However, simple things like checking your pad can help you pick out excessive blood loss. Another important thing you can do is keep your urinary bladder empty. Pee as often as you can. If you cannot make it to the bathroom, call for help and request for assistance so that you can empty your bladder. So when you check your pad regularly and you observe it's filling up within 15 minutes, the pad is fully soaked, I would say that's unusual, So when feeling feelings of, maybe you feel dizzy or you feel faint, just call for help. You'd rather call for help and it's really nothing than not call for help and a problem is delayed or missed out. Remember, postpartum hemorrhage is preventable. Postpartum hemorrhage is preventable, and it is treatable if it is managed promptly. Knowing the risks helps keep moms safe. Kindly feel free to share this recording with any girl out there who will benefit from the discussion that we have today. Feel free to subscribe. Feel free to press the notification button so you may be notified when the next content is uploaded. Thank you for your time. We'll see you in the next episode.